The webinar, How to Get Rid of Gum Infection Without Antibiotics, is starting now. Hello and welcome to this short webinar, How to Get Rid of Gum Infection Without Antibiotics. Specifically, how to get rid of gum infection fast without antibiotics. I'm going to show you. My name's Joe Johnson and I've been working with natural remedies for over 25 years. In fact, on YouTube, you can look at it after this webinar. If you type in dental implant secrets, there's a video of me. My head is the size of a football. I had so much gum infection and I got rid of it without antibiotics, so the proof is there. But I've had a lot of people contact me recently and I just want to go through, answer a few questions about antibiotics and about gum infection. So, first of all, if you have got a gum infection, what is it? What's causing your gum infection? Before we get rid of it, we need to know what's causing it. So, this is a tooth, typical tooth in your mouth. This is your jawbone. This green area here is your jaw, and your tooth is held into your jawbone like that. And this red area here is your gums. Now, what happens is, if you're not careful, this is what happens. You see this area here? It's a socket that your tooth sits in. And there's a tiny little gap here. And everybody's mouth, yours, mine, everybody's mouth is full of bacteria. And that normally isn't a problem because your immune system stops the bacteria getting in here. Because if the bacteria does get in there, it starts to eat your gums. Now, if you've got bacteria into the socket and it starts to eat your gums, your immune system, if it's healthy, it'll respond and it'll send all its killer cells and all the other things here into your gums. So your gum becomes inflamed. That's what causes your gums to swell. Your body is trying to protect you. So you'll start to bleed out of here. Your gums will start to, excuse me, your gums will start to be eaten, literally alive. And then the gums, as they lose the battle, they start to pull back and pull back and pull back. This is what you call receding gums. And you see it in many people, especially as they get older. But it's not necessary, and I can show you how to avoid all of that. So as you lose the battle, your gums start to pull back. And eventually the tooth starts to become loose and it falls out and you lose your teeth. So, how do you stop the bacteria getting in there? Now, normally people will go to the dentist and the dentist will provide you with, these are doxycycline, but there's plenty of other different types of antibiotics. And in the short term, these things do work. And what I mean by that is, if you've got a terrible gum infection, you take antibiotics. Probably within a week or two, your gum infection will appear to have gone. So the bleeding will have stopped. The inflammation, the inflamed gums, the swollen gums will come down. And you think, wow, I've got rid of it. But unfortunately what happens with antibiotics, they do weaken your immune system. So the very thing that, your body's defences have been weakened. So as we eat and breathe every day and fresh bacteria is coming in our mouth, bacteria comes in, it starts to breed again in that socket. And this time, your immune system is weaker than it was last time. So this is how you get recurring gum infection again and again. And eventually the antibiotics don't work, apart from all the other problems which